This study has never been done before.
No, it's never been done before.
Anything like this.
No.
And so the integrative medical approach has now been able to use something that doesn't have any side effects, is short-term, is cost-effective, and effective in results. And this is important. Is this important beyond NET, beyond just this particular intervention?
Yeah, the intervention for at least the groups of people we've been looking at is a slam dunk. And for all the reasons that you mentioned, because what we see objectively is what you noticed when you talked to these participants. Their quality of life improves. And to have an intervention where quality of life improves after such a short period of time, that's a big deal. And I think that the ramifications are far-reaching, and it's the reason that we need to continue to study NET, study this intervention in different populations of people and for different types of issues and problems, because if it can be this effective with this group of people, and that's something that can be generalized to other groups, then wow, that's a big deal.
Well, Dr. Monti, there are a lot of different kinds of people, different walks of life that are listening to this. Some are patients, some are academicians, some are researchers, some are practitioners. And so the vocabulary is different for all these people. But when we're talking about different population groups and generalizing it and so forth, what I think that you're talking about here is that this particular group that we did the study on were all people that had cancer diagnosis. Is that correct?
Yes.
And so when you say general, what other groups or what other populations would be analogous to this group? Who else could we look at?
You know, we can look at anyone who has had significant stress or distress.
Oh, who would that be?
We could start with me,
Yeah.
but I
But
think
that's everybody.
that's everybody. That's right. And so I think that for the purposes of research, you need to have some homogeneity in your population. Mm-hmm. So the reason that we went with this initial group was because these were people that had a clearly distressing event, and the majority of them felt highly distressed about receiving the cancer diagnosis, or some of them had a distressing event related to the treatment of their cancer.
Okay, and for those that are viewing and may have this question, was there any downside? Was there any side effects that we observed? Did we see anything that was negative? Anything that was less than healthy for these patients?
No. I think that one of the things we did in terms of just good research behavior is to make sure that we appropriately screened people for the study. So, the intervention, isn't for somebody, for example, who is acutely intoxicated. Mm-hmm. So if somebody, has a substance use disorder and, comes
Sure.
in on, with a blood alcohol level of 300, they're not going to be a good candidate. So I think that, part of what we did is make sure that the person was appropriate. So not every single person with distress is, but a lot are.
So I have a question for you.
Yeah.
And this is more maybe philosophical, but maybe not. And that is, why is a study like this even necessary? Why do we even have to do something like this? Clinicians, thousands across the world, actually, have reported great results with their patients. That's actually made the funding possible for this study. They've seen the results. The patients like it. It's, as far as we know, there's no safety factor. The intervention is cost-effective. And so why do we even need to do a study?
Well, it's a great question. The reality is that acceptance of any intervention really requires data and research. So anecdotal reports aren't sufficient. And a new intervention requires actually a lot of data for it to be accepted in the different therapeutic communities.
Okay.
And that's why this study was so important, why we're so grateful to the One Research Foundation for providing the funding and all of the wonderful people who contribute to the One Research Foundation so that these kinds of studies can occur. You know, if you look at other interventions for whether they be physical disorders or emotional issues, they take a lot of data, a lot of time. A new drug could take tens of millions of dollars before it's to market because it has to go through rigorous study. A psychological intervention like cognitive therapy, which has become almost a household term and required dozens and dozens of scholarly studies. I mean, Aaron Beck was, and his team were publishing for a long, long time before it caught on as an intervention. This is just the way of the world. There's a lot of people who are understandably cautious. So, you know, how do you incorporate an intervention like this in your clinical practice, whether you're somebody who tends to deal more with physical disorders or emotional disorders? How is that done? How is that done in a way that's acceptable to licensing boards and oversight regulatory bodies and those kinds of things? And so when people see data and publish studies, they feel more comfortable pursuing an intervention like NET, and they feel more comfortable in terms of how they would incorporate it into their clinical practice. We were very thoughtful to design a very efficient study that looked at a lot of parameters, and I think that that makes this particular study a powerful one, and I think more powerful studies are needed, and then more population-based studies are needed. So different types of studies are needed to get to that endpoint, and this is going to require different types of research expertise.